You could almost set your watch by it. This pandemic got its start in the 2019 winter in China. And in Australia, the pandemic surges have included a COVID Christmas wave every year since. This is the third wave in 2023. And while in the past the pandemic was measured in cases, these days we instead rely on other statistics, such as hospitalizations, wastewater testing, antiviral prescriptions, as well as the proportion of COVID PCR tests which are positive.
In the hospital system, the one that I'm most interested in is a proportion of tests that we do that are positive for SARS-CoV-2. At the moment, we're running in the last 7 days at about 9.5%, which has dropped a little bit from the previous couple of weeks, where we're up to 12.5%, 13%. That is similar to what we've seen in other waves, perhaps not quite as high as what we saw during the Omicron outbreaks a year or so ago, but still pretty high.
We can always find reasons for the various waves. In winter, we're indoors. At this time of year, we're partying. But as it's been since the start, the coronavirus is actually calling the shots, made worse or better by our behaviour. It keeps evolving to evade our immune system. The version of the virus that wreaked havoc in 2020 has been pushed close to extinction, muscled out by its descendants.
Merry Christmas!
Even the versions of Omicron from the 2021 Christmas are largely gone.
It wasn't quite the Christmas we wanted, but it's the one we got.
The XBB variant has been the one that we've been worried about for the last 6 months or longer, but we're now starting to see other variants come in, and the one we're watching closely is the JN1 variant.
And if you think they're mild, think again. According to New South Wales Health, if someone with COVID ends up in an emergency department, they have a 35% chance of being sick enough to be admitted. COVID-related deaths haven't stopped either. In 2022, COVID was the third most common cause of death in Australians. The wave peaks, as measured by hospital admissions, are getting lower. That's probably the effect of antiviral medications, helped by background immunity from COVID infections and immunisations. Speaking of vaccinations, it's complicated. As of a month ago, 4.2 million eligible Australians over 18 had had a booster dose in 2023. No one knows how many of those people have also had a COVID infection, giving them some added immunity. In terms of working out how often you should be immunised, research suggests that vaccine protection against severe disease is still okay around 9 months after your last dose if you're otherwise well and not at risk because of age or a chronic condition. Now there's a new version of the vaccine which is targeted at the XBB subvariant. It's available from mid-December. But if you're due for a booster, given there's a current wave, there's an argument not to wait.
My feeling is, given the amount of activity that we're seeing in the community, if people are under-vaccinated and need a booster, I wouldn't hang around. I would go on and get vaccination done as quickly as possible.
If you've had your 2023 booster and you're otherwise well and aged under 75, you don't need another one this year. If you're over 75 and it's been 6 months, you should have another. And you should consider a 6-month booster if you're between 65 and 75 or have a condition that puts you at risk of severe disease. Now the question is, what will 2024 bring?
What we're interested in now is, will SARS-CoV-2 become a seasonal virus, a winter virus, like what occurs with influenza? And the reason that that's useful is that because we can plan for winter, we can plan for vaccines, we can plan for hospital beds, aged care beds and so on.
Meantime, there have been reports over the past few weeks of serious outbreaks of respiratory illness in children in China.
Concerning video emerged showing droves of people lining up to be treated for what's being described as a mystery respiratory illness.
There is no mystery. The Chinese appear to be experiencing bad winter outbreaks of influenza, respiratory syncytial virus and COVID-19, much as we experienced when we lifted our lockdowns and isolation in 2021-2022. China only opened up this year. They're also seeing a bacterial infection called Mycoplasma pneumoniae, which causes pneumonia and rarely encephalitis. Mycoplasma comes in epidemics every few years. and we might be at the start of another one. Reports are coming in from Europe and the United States, but not yet Australia. Just when you thought it was safe to go out.